Hello, and welcome to Diagnosing the Barriers, a podcast by Physicians for Human Rights Israel. I'm your host, Haya Abouardi. In this podcast, we bring you voices from the ground, PHRI staff, volunteers, and partners, as we explore how health intersects with power, inequality, and resistance. We'll take you beyond headlines to understand the real-life barriers to health and the collective struggles to overcome them. For decades, Israeli healthcare institutions have proudly presented themselves as a symbol of coexistence. Hospitals often describe themselves as space where politics stop at the door and where Jewish and Palestinian professionals work side by side, united by medicine and care. But over the years, and even more starkly over the past 2 years, it has become clear that this idea of coexistence is deeply flawed and perhaps never truly existed. In practice, coexistence in Israel's healthcare system has often depended on Palestinian workers concealing their identity, their language, and their political reality in order to belong. With me is Dr. Shani Bar Tuvia, Director of Health Policy in Israel's Department in PHRI. Thank you for joining us, Shani. Shani, tell us more about this growing interest that led PHRI to investigate this question of identity security and what did this investigation lead to?
So when I started my work at PHRI, which was exactly a year ago, I inherited a project that was just starting together with Sikuy Ofuk and the Accord Center. It was a small specific project. The research component at least was small and specific. Accord Center did for us 14 interviews, 7 with Jewish, 7 with Palestinian nurses and doctors, and also were planned to conduct a survey. And this was the research component, and there were other components for this project. And when I started to see the results, the findings, when I started to talk to doctors, not only doctors actually, all healthcare workers, I felt like I have to dive deeper, like I have to do more. I have to understand more about how specifically Palestinian healthcare workers feel today. I started half a year ago, so it was a year and a half into the October 7 and then the genocide in Gaza events unfolding. And slowly I started realizing that Palestinians feel and perceive the situation very differently from Jews. Whereas everyone were willing to acknowledge that there was some crisis after October 7, and there were, a lot of hearings. We will talk today about hearings and about disciplinary measures that were taken against mostly Palestinian employees. People were willing to acknowledge that, but there was a very big difference between Jews and Palestinians in the perception of the current time feeling. And for Palestinians, this is not over. The silencing, the persecution that some of them feel in their workplaces, their insecurity in their workplaces, it's not a past event, it's ongoing. And I wanted to understand this more. I wanted to talk myself with healthcare employees. I conducted 18 interviews, and I also talked to lawyers and organizations that helped people, helped healthcare employees that approached them because they were persecuted or bullied or encountered racism, etc. So I talked also to lawyers and organizations. Of course, we at PHRI, we also had people that addressed us with such issues. So I started collecting all this material and also the media. So some events, some big stories of hearings and even layoffs that consequently got to the media. So I started also collecting this systematically and to try and paint the picture more generally of this phenomena of silencing. And of course, it's not new. What we talk about, what you talked about when you started introduce the episode, the impartiality of the coexistence, of the neutrality, right? We leave politics out of the hospital. It just means that we leave Palestinian politics. It means that we leave Palestinian politics out of the hospital or the HMO. It means that only certain politics can come in. So yeah, I felt like I really want to conduct my research. I also wanted to understand, to try and understand. I was naive. I thought that I could get some numbers. I could understand how many hearings and disciplinary measures were taken against employees and specifically Palestinian employees. I was naive enough to think that I can just ask for the data in freedom of information request and then get it. And then I would just need to count. No. And we can talk about it more. Many of the institutions, it was a long fight to get the numbers and to get the information. And with some of them, we had to petition. So I decided that this topic requires a proper paper, and now it's almost a book, the result, and I'm happy about it. And I think that my most important goal in it was to bring this voice, because it sounds a bit like a cliche, but the phenomena of silencing of Palestinian healthcare in the Palestinian healthcare workers working in the public system, this phenomena of silencing was silenced. It's related to the refusal of institutions to give me the information. And it's related to many Jewish, even volunteers at PHRI, Jewish physicians that were surprised to hear that their colleagues feel insecure in their workplace and feel like they cannot express their identity, like they are constantly being censorized in in hidden measures, but it's in also very also informal measures. Yeah. So the result is, the paper is now ready, almost ready. We still need to translate it and work on it a bit further, but it's hopefully will be published soon.
Yeah, the fact that this phenomenon is so widespread, but so little has been done about it or has been said about it, only shows how the silencing is so embedded in work relations, in the way that Palestinian healthcare workers perceive themselves, how their Israeli colleagues perceive them. Can you walk us through the different forms of silencing that Palestinian healthcare workers report, and what are the layers that are relevant in this scheme of work dynamic versus identity?
Yes. So first, because now we are getting also to the reasons why doctors or healthcare workers in general are hiding or covering or muting their identities. But also there is a small part before that says what are people silencing, and this I divide to their Arabness to a lesser extent, but definitely the Arabic language. This after October 7 also, it was an issue also before that. After October 7, it's even less. People feel even less comfortable to speak Arabic. The second thing is anything that brings to the fore their Palestinianness, their Palestinian identity, so their ideology, but also more everyday things like their families. So someone that said that she cannot talk about what she did in the weekend because it was to visit her family in Jenin, or their families in Gaza. Everything that reminds their colleagues that they are Palestinians. And the third thing, which is related, and in the eyes of the interviewers it is related, the third thing that they are forced to hide is their opinions about or against the genocide, their compassion or their sorrow for the civilians in Gaza, the women, the children. So many express their frustration. They cannot even say that, and the people don't understand that their social media feed is different, and the news and what they see is different, and that they are Palestinians and they feel that it's their people that are being killed. So these are the three things that are silenced. And about the mechanisms, what creates the silencing. So in the paper, I start, and I think it's necessary to start with the context. I think it's necessary to, especially for Jewish readers and a Jewish writer, to talk for a minute about the ethno-national hierarchy in Israel. Because this is what sets the scene. And not only in Israel in general, but in the healthcare system in particular. Palestinians in the healthcare system, just like Palestinians in every Israeli public space, they start in a position of not feeling equal, not being equal, of needing to always prove themselves, of needing to work harder. And if we talk about the healthcare system, this is proven by numbers. Mm-hmm. They need to work harder to get residency. The Palestinians have harder time to find residency, even if they studied in Israel. So compared with Israelis, Jewish Israelis that studied in Israel, they take longer to find residency. And then compared with Jewish Israelis that studied abroad in institutions that are approved, also Palestinians take longer to find residency. So it's not about the institution that they studied. In all types of institutions, Palestinians take longer to find residency. I think that tells a lot of the story of what is the state of mind of a young doctor or a nurse or a physiotherapist that finally found a job in a hospital or in a HMO, and especially if it's a prestigious job. So this context, I think, is crucial to start and even understand how, I don't want to say brave, because it's not that the people that are not talking and not speaking out are not brave, but how difficult it is to even try and, show your Jewish Israeli colleagues their blind spots. Mm-hmm. And so that has to be the context. And of course, when it comes to medical career, it's even more extreme, because this is a highly competitive, highly hierarchical career. You always need to work in order to prove yourself. The school takes so long. It takes so long until you get to the position that you're finally working and getting a monthly salary. You will not lose that so easily. People are really anxious for their careers, and that was very clear from the interviews and from the survey and from all the sources. So this is a necessary context to understand. And then after October 7, you have the crazy wave of the disciplinary measures, the formal silencing, what you call. So the hearings, the number of hearings, I'm saying in the paper, it's just probably the tip of the iceberg, because many institutions refuse to reveal the data, because only governmental hospitals are obliged by the Freedom of Information law. So I could, to begin with, only ask the information from 11 hospitals, not from the 20-something, 30-something that are active in Israel. So to begin with, I only had the tip of the iceberg, and still you see, first of all, that from the institutions who admitted hearings that took place because of social media posts and activity. So from the institutions that admitted and gave me data, in all of them, hearings like this took place. And it sums up to something like 20 hearings. Mm-hmm. And then you have the cases that were revealed in the media. And then you have the cases that lawyers told me about. So all in all, in the paper, the cases that I review, it sums up to something like 30, 40. Mm-hmm. But we know also from organizations that it was probably several hundreds in the several months following October 7 and then the genocide. Probably hundreds, a few hundreds of hearings and talks, disciplinary talks, they call it, which is the less formal type of hearing. So I assume that it was several hundreds, and I explain it in the paper. And you can see that all of our interviewees, they talked about it. They knew of cases of their colleagues and friends from their institution that had a hearing like this. Mm-hmm. They were referring to the famous cases, Dr. Abed Samara, Dr. Annan Abbasi, the husband of Dalal Abu Amne that was persecuted. The people that we interviewed were all mentioning these cases. So, of course, the famous cases also have a chilling effect, because even if you don't have a colleague in your department that went through such a disciplinary measure, you know about the famous ones. And it worked. And many people that I talk to think that this wave of hearings came down, not because the tolerance increased in institutions, but because people learned their lesson and stopped talking. Interviews expressed this feeling, and also the experts that I talked to, the lawyers, the organizations, they also thought so.
And talk about the institutions that did and did not respond to your freedom of information request. Those that did respond, what was their tone? Like trying to understand what is their position. Do they seem apologetic, or do they own this position 100% and easily find a justification for it?
Yeah, I quote in the paper. So with all of the institutions, the interaction, I don't know if all, but with many of them, some of them just gave the numbers, very few. But with others, yeah, there was a bit of a feeling of, but we have coexistence. Why are you ruining with all of your questions, you know? And the height of it, and I quote it extensively in the paper, was the Shamir Hospital, the Asaf HaRofeh, who, until now, I'm still in correspondence. I didn't petition against them yet. I'm still corresponding with their Freedom of Information supervisor. I'm still like trying to make him give me the numbers. And in this process, we're talking about months of correspondence with him. I have several really interesting emails with him, and I quoted one of his emails almost fully in the paper because it's so interesting. He basically gave me, and it feels like if you read it, I feel a bit like he's yelling at me. We have coexistence. We have coexistence. We eat together. We laugh together, he writes there. We have senior physicians working, we have physicians working in senior positions from the migzar, from the section. Of course, he doesn't say Arabs. Of course, he doesn't say Palestinians. So from the society, I don't know even how to translate migzar to English, but it's very clear that he was super defensive, and yeah, like this long of an email, you can see it in the paper, basically talking to me about how much coexistence they have, and just give me the numbers. Just give me the numbers. You know, because in institutions that didn't admit or they didn't write the reason for the hearing, but did give me the nationality of the employees, you could see, and that's also in the paper, you could see a spike in the number of hearings or in the rate of hearings conducted to Palestinian employees for, I don't know, professional reasons, discipline. Sometimes they write something general, sometimes they don't write what was the reason, but you see an increase in the ratio, in the rate of hearings to Palestinian employees in November 23. Like you see the spike. So for me, that's in itself says something. And we have interviewees that talked about it. Someone mentioned someone that was laid off from her department for professional reasons. His professional functioning was not good enough. And she says, but he was working there for 20 years. There were no complaints. Now suddenly they remember to question his professionalism.
This actually leads me to my next point about like working for 20 years. And I wanted to ask about the professional hierarchy and how this serves as another layer in this equation where your seniority does not grant you any security in the face of the nationalistic this exclusionary discourse. Can you tell me more about this?
Yeah. So in the paper I write it that one of the interviewees said that junior employees will not talk because they are afraid and they need still to work on their careers. But senior employees will not talk because they got to where they got to thanks to not talking and thanks to not being two Palestinians. And the term good Arabs, the sarcastic terms, when it is expressed by Palestinians, good Arabs, several interviewees repeated this term and said that those that get the senior positions there must be good Arabs. They must not show any criticism of the state, of the army, of the genocide. And there are examples, there are famous examples, no need, anyone in the healthcare system knows what I'm talking about when I say that there are famous examples.
It's to fully identify with the Israeli narrative and Zionist identity of the institution.
Yes. It's people. Our interviewees felt that it's almost like a requirement to get to a senior position. And I want to say the paper doesn't deal with that. Guy, our director, his PhD deals with that. The paper doesn't deal with the collective consequences of this. What it means when your intellectuals, when your smartest, brightest are forced to, in order for them to have a career, a professional career, are forced to silence. What does it mean for the Palestinian society in Israel that the intellectuals are being paralyzed?
This, and also what does it mean, at the end of the day, we are physicians for human rights, and the question of, securing the right environment for good healthcare treatment, how does that affect, doctors' abilities to remain professional?
Yeah. There's also the ethical issue. So the risk that doctors will not feel comfortable even to protest, wrong treatment that they see. So this very issue. But wider than this, when doctors are forced to silence part of their ideology, and especially when it's compassion or sorrow for the death of innocents, when they are forced to silence even something like this, and many of our interviews talked about it, it brings to a crisis, to internal crisis. They say, we are doctors, we are nurses. We are supposed to care for people. We have the ethics that guide us. How come we cannot support life? How come we cannot resist death? And how come our Jewish colleagues, and we didn't talk about this, we didn't talk about the militaristic atmosphere in the healthcare system, which is also dealt with in the paper, our colleagues that support death and that support war crimes and even make genocidal remarks, nothing happens to them. They just stay in the system and in their senior positions. So what does it mean for the medical ethics, and what does it mean for us as healthcare workers? What does it mean for the system? But yes, also what does it mean for us giving treatments to our patients? And that's the last point I want to make in this context. Some of the interviews talked about how it burns them out, because you're forced to detach, to become, one of them said, to become a robot. You come, you see the patient, you mark, like you have some emotional detachment, and you become like a machine. Your treatment of your patients is less good.
And do you see this as part of a wider, let's call it, trend in other sectors, academia, media? And how do you think this is different than in other sectors?
Yeah, so the sectors that this was most prominent are sectors where you have Jews and Arabs working together, and the Palestinians are still a minority, but a significant minority. Because if it's one Palestinian employee in a big industrial system, then this employee, of course, will not even dream to, so you need the tension to be there for this to become an issue. So it's in systems that you have a significant Palestinian minority working there, usually educated. So I'm sure that the cleaners at the Hebrew University are not being silenced because they don't dream about talking. And so the sectors that I saw that were researched in that respect, or that had cases coming up in the media, is a bit in the high-tech industry. There is a small research about silencing in the high-tech industry, or the feelings of high-tech Palestinian employees since October 7. Of course, teachers, Palestinian teachers working in the Jewish system. Also, before I say academia, I wanted to say something else. Lawyers. There are a significant amount of Palestinian lawyers, so in law firms that you have both, or in the public sector. And academia, of course. And academia is also the silencing arena that was most researched and talked about, and Academia for Equality have a good report on that, and Adala will publish now a report on that. So yes, definitely in other sectors as well, with many similarities. I think in the healthcare system, the anxiety for the career is more profound. Again, it's a career that you pay higher prices in order to get to. So I think the anxiety for the career is more profound. I think that the presumptions, so the ethos of neutrality, medical neutrality, of the medical ethics, all this ethos, it makes it even more interesting of a case to focus on, because this is the place, and interviewees were speaking this out. They had expectations. That's why they're disappointed. They thought that by working in the healthcare system, they will find a way out from the violent, nationalistic, chauvinistic Israeli public space. They thought that the health system will be a bubble. That's what everyone told them, that it is a bubble. So I think that's what makes the healthcare system a special case.
It's a very interesting angle to kind of ask the question of, if we are talking about a system whose group of people who are being silenced and oppressed are also not empowered enough and have all the reasons to stay in their place, how do we make progress in this reality?
It's very difficult. I think it's a lot of this is dependent on Jewish colleagues. I make some concrete suggestions at the end of the paper, but I also start with a caveat or with a disclaimer saying that if we recognize that the problem is the ethno-national hierarchy in Israel, then of course these 5 or 6 recommendations will not fix it. But it's a place to start. It's not good times for optimism. But I think that relatively, comparatively to other systems in Israel, yes, there is this thing in the healthcare system that people, including senior figures, they are good doers. They want to think of themselves as good doers. They want to do good. So I hope that many people as possible will start being exposed to these voices and listen to their colleagues. And I think that because it's a phenomenon of silencing, and speaking out is the beginning, but I don't expect the Palestinian employees to do this the first steps of speaking out. I completely understand why they can't.
Well, I wanted to ask you if any of the recent developments give you some sort of hope. But I will leave it to you to answer or not.
Well, yeah, as I said, it's not good times for optimism. Hope, I assume you ask specifically about this topic, not in general. I actually think that because leaving Israel as a healthcare employee, especially as a doctor, but also in other professions, is very difficult. Like to find a placement abroad, to prepare the papers, to do exams, depending on the country that you want to move to, etc. It takes a long time. The feeling that I got from my interviewees, and we didn't ask that in the survey. We should have. Are you planning to leave? Do you like something like this? We didn't ask that in the survey. I have a feeling that the wave of Palestinian physicians and other healthcare workers leaving Israel is going to grow. Because it's people that decided to start prepare their living 2 years ago. And if we want to stop that, there are some very immediate measures that need to take place. And I'm not sure that decision makers in Israel will take these measures. So no, I'm not so optimistic about this topic. My modest wish for this paper and for this work is that at least some people will find themselves in it and will find some relief. As one of my interviewees said, he said, I'm so happy you called. I'm so happy you approached me. I'm not sure it will help, but at least it will be out there.
Yeah, it's indeed very meaningful to have these stories revealed, although they carry a lot of fear in them, but they are some sort of a step towards surfacing this issue and maybe reaching a level of needed solidarity within the medical community that will mobilize some sort of a change. Thank you so much, Shani.
Thank you.
It was a pleasure talking to you. We have come to an end. If you liked this episode and find it insightful, please subscribe and share it with others. Until next time.